Thank you so much for joining us, Brenda.
Yes, thank you so much for having me, Lynn Marie. It's
I always,
awesome to be here.
Yay! I'm so glad you're here. I always start by saying how I know the guest, and you and I are just meeting now, but we were introduced through one of my favorite people, Josh Trent from Wellness Force, and I know he had just spoken with you, and the episode that you did on his show was, as I was just telling Brenda ahead of time, the only time I think I've cried at a Wellness Force episode. It was so powerful. And so I was stoked when Josh was like, "You got to talk to Brenda." I was like, "Well, fantastic. I'd love to." By the way, don't worry, everyone. I don't think you're going to cry at this episode if you're like, "No, I'm at work." But I think she's got a lot of great information that she's going to share through her own journey. And we're going to talk a lot today about intuition. So, Brenda, if you could take us back to when you were having some health challenges and things that you were trying were not working.
Yeah, so, for me, I really resonate with this idea of quitting because I was an athlete my whole life and, Division One athlete. And then after a bunch of stressful circumstances, constantly going, my health just completely went down the tubes. And this mindset of an athlete is just like, do more, push harder, go, don't quit. And so just it really resonated with me to contemplate, after I was contacted by you, like, oh, where in my life have I had some really powerful and strategic quits and how important that is. And so, yeah, so my health just rapidly started declining for no apparent reason. Like like I said, after I graduated from college playing soccer and physical therapy school and getting married and becoming a physical therapist, I started to develop rashes all over my body. Hair started falling out, started losing weight, and then I could hardly get up the stairs. And then I developed this. So for 2.5 years, I had rashes covering my entire body. I basically had to pack my body full of ice to sleep. And needless to say, it's pretty intense time for me. I was seeking out doctors, all kinds of doctors, trying to get answers with blood work coming back as quote unquote normal. And obviously, it was not normal. And then I developed a systemic infection that I couldn't hardly talk or eat. I had these lesions all in my mouth and throat, and they just couldn't figure out what was wrong. Like, I thought I was going to die. I took 4 rounds of antibiotics within a month and a half, and I just wasn't getting better. And I was seeing a specialist, and they just said, we're worried that this is going to get in your bloodstream and this is going to be, potentially fatal. And so that was really scary time for me. And I just happened to find an article called Natural Solutions to Drug Resistant Infections. And I had no idea about natural or holistic healing at the time. But that antibiotic resistant word caught my attention. I was like, okay, I'm really desperate here. I'm going to read the article. It talked about a particular type of essential oil that was curing malaria and various, really intense infections. So I thought, what the heck? Nobody can really help me at this point. So I'm going to take it. And the infection went away in 3 days. And it was like a huge opening for me into this realm of natural and holistic healing. And so at that point, I really started to sit back and look of like, I had just really been expecting these doctors to heal me and to fix me and these drugs to fix me. And it's sort of the mindset we kind of grow up with of like, if something's wrong, just go to the doctor and he or she will heal you or fix you. And I just had this experience where I realized I was kind of giving all of my power away. I wasn't really listening to my own body or own intuition as to why I might be having these health issues. So just taking that essential oil and having that experience, I really started to look at like, okay, what could potentially be causing this and really taking responsibility for my own health, my own life, and quit giving my power away and being a victim of my life circumstances. So that was really my first, huge conscious decision of like quitting, you know, basically making other people the supreme authority over my health and my life. So,
Ooh,
yeah.
I love how that's phrased. I love quitting, making other people the supreme authority. That's so good. And so, from that experience that you had, now your eyes are open and you had a little mindset shift. Okay,
Yeah.
now I'm in the driver's seat.
Yes.
How did that affect when later some new symptoms popped up?
Yes. So at that point, that was actually this awakening moment of like where I actually start looking at my life, like, okay, how am I living and what are my choices? And I really realized I had a really potent moment of grief of going, oh my gosh, I've been living my entire life for other people. I've been living my entire life to try to please my parents, society, and like I really had this moment of like, what do I really love? Like, what do I really want? Like, I'd been playing soccer since the age of 4, all the way through college, getting a college scholarship, and I had the moment of like, do I even want to play? Did I even want to play soccer? I mean, I was really in this moment of like, wow, like, how much of my life have I been living for other people? And so, I began to make that conscious decision of quitting, quitting living my life, not only, giving my power away to doctors, but just like my life, this one precious life to like, other people's ideals of what success is or what happiness may be. So there was that. And, it really took me many years to recover my health. Like I was really sick and I started to explore natural and holistic healing, nutrition, lifestyle changes, mind looking at how my thoughts were affecting things. And then, I mean, I was laser focused like a tenacious athlete trying to fix myself. And that was 8 years of really working hard, spending hundreds of thousands of dollars on natural and holistic, supplements, modalities, healers, and gradually restoring my health. And then 8 years later, I was diagnosed with breast cancer.
Wow.
Yeah. And so that was, right before I had, made this decision like, okay, I think I'm finally healthy enough to have a baby. And so it was really tragic. And of course, another huge, like, you know, bomb gets dropped, and you start to reflect and go like, gosh, I've been doing all the quote unquote right things. I've changed my diet. I was labor focused. I started, slowing down. I started changing my exercise. I, was doing all these things. But what I realized, I was really focused on healing myself from the physical standpoint only. And like when I really sat with myself, I really understood that, or I got this message. I call it this divine whisper that happened. And I really started, this is when I began to start to listen to my intuition, really. As I heard that if you're going to survive, you're going to have to learn to listen to your heart. And so then I made this decision. Like I had no clue what the hell that meant to listen to my heart, honestly. Like I knew it was like one of those things from like divine, like download, but it was a kind of a new thing for me. But I was like, you can't keep doing the same thing and expect a different result. And so what is missing? Why is this showing up for me? And I knew it had to do with some emotional and spiritual, healing that needed to happen. And so at that moment, I quit, made the commitment to quit letting my head lead or to make decisions from a place of fear or intellect, and to really learn to listen to my heart no matter what, even in the face of, even if because I knew I was going to take I wasn't going to go down the conventional path of treating cancer. So yeah, so that was my commitment, is to quit, letting my heart, my mind be in control. And I'm still on that path of learning to listen to my intuition and trust my heart. And that was really a powerful decision for me to really heal and create an extraordinary life from a seemingly tragic, scary situation. So
Yeah. Oh, I love how that's phrased. I like how you phrase it as not, I'm going to start listening to my heart. I'm going to quit listening to my head and living out of fear, which is fantastic. I know that in this breast cancer treatment journey of yours, you were still, you were doing both complementary things and going to Western doctors. And cancer, I think for most of us, is such a scary diagnosis that if ever there's a time you're going to be living and making decisions out of fear, that would be it, right? And so I know that a Western doctor presented you with an option, and your intuition seemed to have a different idea, correct?
yeah, yeah. So I actually went to an alternative healing clinic first and did a bunch of treatment, and I actually did get some improvement. but it just wasn't the mass wasn't shrinking to the degree that we wanted it to. And so I went and had a biopsy to get the official diagnosis, just to kind of see if that was still, if it was malignant. And I did, the doctor that I was consulting with was really almost fearful and very irritated and frustrated that I was even exploring natural or alternative medicine. And so when I got the results from the biopsy, which was terrifying to be in this office, and it was just really like, could feel the energy. It was just really a fearful, like negative energy. And she was like, you have it's malignant and you need, and she was about a foot from my face and was like, you need to do this and you need to do, chemo and radiation right away. And you need to do this and you need to do that. And we need to get on it. And I was like, I just could feel the constriction, and I just like was looking straight ahead. And I said, I need to breathe, and I'm not going to do any of that stuff until I go home and like really sort this out. So I need you to back off. And so, needless to say, I didn't go back to her because I just knew that wasn't the person for me. And like, that's not the approach, that I was not taking a fearful approach. And she was like scared that I had wasted time doing this other stuff that she didn't feel was helpful. Yeah. So yeah, that was my not so good experience.
Yeah. And this is where I will say that Western doctors, being one of them, we run the gamut, right? There are some of us, like myself, very fond of alternative medicines and think that anything that you want to try that can be helpful, as long as it's not harmful, great. And then there's the old guard. And I think things are changing, maybe not as quickly as some people would like, but I do hope that I'm seeing that it feels like I'm seeing a shift where people are, everything is shifting to more, okay, mindfulness wasn't a thing 15 years ago that everybody talked about, right? And meditation wasn't a thing. And now this is actually being taught. When I went to medical school, I don't think meditation was taught for 1 second. It was not a thing. We had like a half day of maybe cultural competency and then nothing about anything mindset related. So I'm pretty sure that there's a shift happening, but we're still on that cusp where a lot of people are kind of dogmatic. And the flip side as well, like I'm sure there are plenty natural practitioners who are like, don't go see a Western doctor, like for sure. It's a lot of kind of weird territoriality instead of like, let's all work together for the betterment of the patient, regardless of whose treatment wins, quote unquote. Like the win is just, does the patient get better and feel good about their outcome,
Yeah, no, I agree. And actually for me, because I had such that initial experience 8 years ago of where I felt that Western medicine failed me. Okay. That was the thought process. And then, so I was really jaded and really like anti, and then going through the process and then, getting diagnosed with cancer, I was like, oh, I don't want to do any Western medicine. It's not helpful for me. I don't want to take any of the drugs. And, but my commitment and the voice, the divine download from spirit was like learning to listen to my heart, not don't do conventional medicine. It was like, what's my intuition? So it was really interesting along my path that I started off with alternative and holistic healing modalities. And then along the path, which I did several things, and but then I was also felt led to get a mastectomy and to do some surgical intervention. And like, I felt that like, inside of me of like, no, I don't, no, that's not what I want to do. I don't want to do any conventional medicine. But it was like, literally like, okay, no, Brenda, your commitment is to listen to your heart. And I felt that my heart was calling me to take this integrative approach of doing both. And so it was very humbling and actually very beautiful to like, yeah, it's not like one or the other. It's really like, and when I coach women and I do this work, I help women to really reclaim their power and to, experience greater health and happiness in their life, and especially people that are dealing with chronic illness. And it's like, there's no one path that's going to heal you or everyone. My path isn't going to be your path. But what I know for sure is that when if we come from a place of listening to this fearful voice, or we make decisions from a place of fear, it's never going to be your highest and best good. So if you can learn to listen to your heart and trust your intuition, whether that be completely conventional approach or, alternative or a combination. Like, I know and I trust that your heart's going to guide you. And so learning and teaching people how to do that, which I think, most of us aren't really taught how to do that. So I'm so glad that you mentioned that, and that my story kind of beautifully blends those sort of like polarizing like ideas to like, okay, your intuition can guide you, and there's a place for both conventional and holistic, or integrative alternative medicine.
Yeah, and very often, like you said, they're complementary. It's not like, okay, if I do this Western thing, there's a contraindication to also taking some oregano oil or whatever. Like, rarely
Right.
is there some, okay, this is going to do more harm than good if I do these both. And it made me think about the fact that there's a known placebo effect, right?
Oh yeah.
So if you think a therapy is going to work, it's more likely to work regardless. So if you go and get the same therapy, say the mastectomy, and you got it because the doctor made you, and you didn't really have any feeling like this is going to work, I'm just doing it out of fear, versus eventually getting it, but I'm guessing from a doctor who you felt much more comfortable with and who had convinced you, or at least, talked through to you to say, there's a much higher likelihood that this is going to be the end all be all, let's get this mastectomy, and then you believed in it and you were doing it out of a place of heart-centered confidence, that your outcome is almost just like scientifically, statistically, via the placebo effect, more likely to be positive because you believed in the therapy.
Right. Yeah, no, exactly. Yeah, that was, I guess you could look back and argue like, that mastectomy was recommended at the beginning, and I chose to go to two different, holistic cancer healing centers, and, do all kinds of different therapies, and then ended up back doing the mastectomy. But it was like literally where I felt called to do it. And I mean, I believe and I trust that the timing was amazing, because when I went in and I got that done, I actually had, and this might sound pretty crazy, but I had actually done something where, used a topical blood root salve where cancer was extracted through the skin. And so it actually came out all around the breast in the axillary region, but it did not come out at the main mass that was there. And so when I went in to have the mastectomy, it had not spread to the lymph nodes. And I believe that all the other things that I had done up until that point, and so my intuition at that point at the beginning was like, no surgery, no chemo, no radiation. I'm just going to go down this path. But then it led me back to actually having the mastectomy eventually. And it was just trusting in the timing of things, that it was all, divinely orchestrated. So, yeah, I mean, and at that point, even though my head didn't want to do it because it was like, oh, I don't want to do surgery. Of course, no one wants to get their breast removed. But when I really sunk into my heart, it was like, no, this is what you need to do next. And so, that was my path. So I trust that it was, what was meant to be.
Yeah. I like what you brought up earlier, is that when you got the message, listen to your heart, you did stop and realize that is such a vague command, right? So many of us, we tell that, oh, just, well, what does your heart tell you? But as you mentioned before, we are not necessarily brought up, taught, being taught how to listen to our heart. Like, what does that look like in my day-to-day life? And
Right.
now in your work with women, how do you convey to them ways that they can listen to their heart or pay better attention to their intuition? Because as you and I were discussing before we started, that's a huge part of knowing when you need to quit, is being able to tune into your intuition and be like, oh, this isn't just a nauseated pit of my stomach feeling that came out of nowhere. It's
Right.
for a reason. And you have to tune in. You have to be able to tune into that. And so what do you recommend to the people you work with?
Yeah, there's a couple things. So one thing that for me, being someone that was very much analytical and logical and like very much in my head, with the beautiful thing of following my heart led me to Heart Math, the Heart Math Institute. And so I ended up becoming a Heart Math certified coach, and Heart Math really bridges science and intuition, and show like study, basically you're able to look at heart rate variability, and by engaging in elevated emotional states and slowing the breathing down, you're able to get into the state of coherence. And in this optimal physiological state of cardiac coherence, we're much better able to access our intuition. So it's like the heart and the brain are actually in sync, and we can measure it. So that really met me where I was at. Like, okay, I can actually scientifically see that listening to your heart and accessing the heart is not just woo woo. It actually is based in science, and there's all these major benefits, like not only listening to your intuition, but decreasing depression, anxiety, better focus, better performance. Really amazing for like athletes and first responders and military. So like that was like helped me begin to like gradually sink into some of the more like esoteric or difficult understanding of like listening to the heart. So I practice and teach coherence, like teach women how to get into that place of coherence with particular tools and technologies. And then I think the other thing is, really helping women to implement a morning practice where I'm like, I think, it's beneficial for us all to have at least a 5 to 20 minute morning practice where we are able to sit and be still, meditate, and to check in with how we're feeling and how our body feels and what our emotional state is, to start to observe those things, like you said, because if you sit with it and you're like, oh my gosh, I was running around all day for the past week and month, and I didn't even stop to check in. But if every morning you stop and check in and you go, oh my gosh, I've got this pit in my stomach, and you start asking what is that about? And you're like, oh, actually, I realize I'm really frustrated with my husband. And like you just start asking, it's this more of a more awareness piece of like what you're thinking and feeling. And so you have to create space. You have to create space with meditation, with stillness, with walks in nature. You just need to, we're not taught the importance of that either, but just, creating some stillness and some space to check in.
Ooh, I appreciate that very much because for sure it's go, go, go. And we get kind of numb to that maybe anxious, overworked pressure in our chest feeling because we just
Yeah.
live there for so many years. I mean, I don't think in medical school residency fellowship, my chest ever didn't feel heavy. It was like 24/7 amped up,
Yeah.
like as if my adrenaline level was like about to explode through my head.
Yeah.
And you get used to it. It's like this, it's not your comfort zone, but it's your familiar zone. And it takes some of that stillness to reset and realize, no, 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 that's not normal. Here, let's have you experience a few minutes of normal. Go take a walk, sit in the grass for a minute, and realize, oh, my chest is not so high, it's so heavy, so it's about to explode feeling, and then you're able. I think you're better able to discern when it does feel like that, and then you can stop and be like, okay, why does it feel like this? Well, I was fine in the park 3 hours ago. What have I done in the interim that now
Yeah.
has totally changed that? I also wanted to talk a little bit about the the thing we talked about at the very beginning about giving over your supreme authority to your body. You in this process have had to make decisions where somebody who, technically, like we saw, cancer is scary. Generally, you have cancer, you go to like a medical doctor, and your intuition essentially was saying, ignore what society would say is the authority over your body. Did you
Yes.
have any kickback, any pushback that you had to kind of deal with or explain through when you'd make those decisions?
I made a really, really conscious decision to keep what was happening very quiet. And the reason was I intuitively knew like, okay, you need to learn to listen to your heart in order to survive this. And then I was also like, crap, I don't know how to do that. And then I knew in order to do that, I needed to really get still and quiet and learn to listen. So I told just like my immediate family and really close friends. And I was very upfront with like, this is the approach that I'm taking. And then my boundary, my request is that like the vibration at which I choose to be around is one of healing and love and wholeness and seeing myself as whole and well and healthy. And so if you feel like you are really afraid and you're scared and you like, I love you, but like, I'm not going to choose to be around that right now. So that's the agreement and the request that I had with my intimate circle. And I also didn't go out polling people like, what do you think I should do? And which I have had done in the past of like, I have a lot of healer and researcher friends, and it's like I was a researcher. I was And so like I got off the internet, like all, it can get really scary when you start Googling, outcomes and stuff. And I just like really pulled everything in. I was like, okay, I'm really going to listen within. And so I didn't, because I was very vocal and like set the precedent. And I was very conscious not to tell my story to everyone that was going on, because people will offer you their 2 cents. If you like, you mention you have cancer, you're like, oh, well, my mother died of breast cancer. And you're like, okay, like I don't really like, it's a very tender and fragile moment where you so easily slip into a place of fear, especially if that is your pattern, which it is for a lot of people, and it was for me. And so I just was very created some really, really, really like strict boundaries around what I said and how I said it, and then like what type of energy I chose to be around. So, and I would recommend that for anyone that is dealing with a chronic health issue, is that, yeah, you get to, it's all about energy. And when we're stuck in this place, because I was not resonating with fight cancer, I have to fight, I have to like, I really wanted to step away from all the fear and the fighting and the battling and just really look at this like, and what came to me was like, can disease be a divine opportunity? Instead of something I have to battle and fight against, can it be a divine opportunity for radical growth and transformation? And it really was that catalyst for me to create an even more extraordinary life. Like, was it the most challenging thing that's ever happened to me? Yes, but it's also the most beautiful. And I believe that that can be, if you're really, really conscious and you make that choice and you're really, create those boundaries and say, hey, I'm gonna choose this path, instead of staying like in this fearful place. So, and I'm also as a health practitioner and a holistic, health. And so it's like I've had some experience in the field. So I was able to make those decisions, very consciously. But yeah, I didn't get a lot of pushback because I didn't allow it.
I love that. I love it. And what you said, okay, this is valuable for anybody with a chronic illness, but I think this is valuable for anybody going through any type of quit. You're about to quit what everybody else would think is your dream job. Well, when you go to tell people, I love everything you did. You said, okay, I'm not asking for your advice. I am telling you what I have already consciously decided. I have done the work. I know this is my choice. I would appreciate that you either, support with the energy that I'm at right now that I need for my own transformation, or you step back for a while because other people projecting their fears onto you about, oh, so you're going to quit a job and be an entrepreneur, like, oh, I would never do that. Isn't that scary? And all that kind of, like you said, that negative energy. You don't want that around. And so I love that you set those boundaries, because a lot of us, we are not quite as upfront about it. And so what I think happens more often is that we'll have some friends that will start to give out the negative energy, and then we'll have to just kind of find ourselves pulling away from them as we make the conscious decision to like keep our 5 people that are around us at the vibration that we need to support us. But you took one step further and you're like, especially for healing, and but if whether you're trying to heal from a disease or trying to like keep yourself sustained through a difficult career transition, the
Yeah.
energy that's going to be supportive of you. And I love that you were like, this is the energy that I need. And especially when you're going through like a cancer, people are probably going to perk up and be like, okay, this is what she needs.
Yeah.
We're gonna do that. But it's applicable in many areas of life. Like, hey, if I'm gonna make this business work, I can't have constant negativity around me. I have to be feeling supported. So this is what I would love to have from all of you that are close to me. And if you're too afraid of me doing this, then, let's meet back up in a few years after I've already pulled it off. But that's
Yeah.
a huge lesson for everybody. And the last thing that you'd said is something that it was really impressive, because I think a lot of people they'd go through what you went through, and then years later they would look back and be like, oh, that was a total divine opportunity. And you were so proactive in the thought that you realized that, okay, the universe has a path. Things tend to happen for a reason if we allow them or we examine it, but we generally just see it in hindsight. And you're like, forget that. I'm going to see this in foresight, because I know I'm going to look back and then later think it was a divine opportunity. So instead, you decided, okay, let's take it as that now. And I'm guessing that that helps you come from a less of a place of fear and more of a place of like, this is happening for me.
Yes, yes, and I don't want to like minimize the fact that like I had my breakdowns and like I had my like, oh my gosh, I'm scared. Like from taking this more of this sort of rebel, different approach that like I didn't have this modeled for me, with somebody else. I didn't have the person that was like walking me down this path. And that's essentially like why I wrote my book and why I'm doing the work that I am, is because I want I wanted to create that holistic healing roadmap and that support that I didn't have, that I wish I would have known these things, 10 years ago, and I wouldn't perhaps have had to go down this path of, and all these components to healing that are important. So yes, I had that awareness in my like soul, but I also had my human breakdowns and my fear freakouts and like, am I on the right path? Like, did I do the right thing? Am I crazy? So I just wanted people to know that, that's totally normal.
Yeah. Oh, I appreciate the
Like,
transparency. Yes.
yeah, like full transparency is not like, oh, this is fabulous. I'm going to learn so much from this, cancer thing. It's like I had my, like all out, bawling. I'm terrified, and
Yeah.
then, but the thing is like I knew like I couldn't stay in that energy of like, okay, like, yes, feel the feelings, like, and that was part of the work too, of like, the emotional healing piece is learning to really feel my feelings and to heal those emotional wounds. And so that was part of the practice of, yeah, feeling the fear, feeling the anger, feeling all the stuff, but ultimately not indulging and staying in that energy as I made decisions and move forward. So just
Yeah.
wanted everyone to know that I just didn't float along and everything was easy.
Yeah, I so appreciate you sharing that. How I envision these sayings, like say the saying is, okay, can cancer be a divine opportunity for me? I see those, or saying the universe has a plan, or everything will happen as it should. I see those all as kind of like life, the life raft or whatever, that you're kind of everybody flounders in those feelings, right? And then
Yeah.
if you don't have that saying or that reason that a thing is happening, then you have nothing to like reach out and kind of help pull yourself up. I think it's a lot harder. Whereas it's not that you just float around on that life raft where I'm like, everything's happening for a reason all the time. You're mostly drowning like everybody else. And then you eventually remember at some point, like, yes, I just bawled my eyes out because this thing that just happened to me was terrible. And then as the tears dry, maybe you get a little glimpse of that raft coming by, like, oh, remember, this is all happening for a reason, that you could like reach out, and that helps you pull yourself up a little bit. It's not
Yeah.
that those of us who have one of these mantras just walk around with it all the time and we're Teflon. It's not like
Right.
that. You still, like you said, you feel the feelings, but I think it just feels kind of like a little bit of a something to hang on to when everything else seems to be kind of dissolving. Is like,
Yeah.
remember that this will all work out. There's a purpose to all this. There's a higher calling somewhere that this cancer will lead me to, helping other people later, as it has. But
Yeah.
yes, I appreciate you sharing that. Nobody walks around like, once we've decided cancer is for us, everything was easy.
Yeah.
But
That's a good analogy. It's a good having an anchor. It's like almost having a mantra or an anchor, like, like the truth. Like these are the truths. And that's another thing of that, like, um, that morning practice or those times of stillness when you coming from a mindset of mostly living from a place of fear, is like every single morning I would like remind myself who I am. Like, oh, I'm a child of God. I have like the ability to heal within me. It's like reprogramming. It's like the power that created me can heal me. And it's like, okay, this helps to help dismantle all of that fear, around what's happening. And so I think that's another important piece to like, really create some stillness and to reprogram the mindset, to quit thinking one way and to start thinking another way or have a different mindset. It doesn't just happen. So you've got to kind of step away and you got to do some things and create some practices and some disciplines and some tools to help you shift.
yeah, absolutely. Brenda, this has been so very lovely. And I really hope that people listening take some advice, because I know you have a book out there that perhaps people could read. So if they're in a position where they're having this struggle, maybe even with a chronic health or a different type of quit, and they're having some difficulty listening to their intuition, or maybe they're getting better at it, but still kind of have a little place of fear, like, am I the supreme authority over my body? Like, I'm feeling this one thing, but society says another. Can you tell people where to find you so that they can learn more?
Yeah, actually, so yeah, I wrote a book. It published the end of last year called Sick of Being Sick, The Woman's Holistic Guide to Conquering Chronic Illness. And right now it's on Amazon, but and the hard copy comes out later this year. But I'd love to offer your community a free copy. And so
Oh,
if you would like an electronic copy, so if you'd like to take advantage of that, you can go to www.sickofbeingsickbook.com and then just enter in your information and you will get sent a free copy of the book. So,
thank you so much, Brenda. I really appreciate that.
you're welcome.
Thank you so
Yeah,
much
I
for
hope.
coming on and sharing. Yes, go ahead.
Yeah, no, I just like I hope it supports and empowers all of you that are listening on your healing path. And that's why I wrote it. That's why I wrote it to support you. And it is specifically says women, but there's my wholehearted healing approach is not gender specific. You can benefit from reading it too if you're a man. But my focus and my work is with women. So.
I understand. Well, I appreciate that part. Brenda, thank you so much for joining us today.
Oh, thank you for having me. I
Absolutely.
appreciate it.
Absolutely. And for everybody else out there, until next time, happy quitting.